What are the three types of testing that an ERISA disability carrier expects to see in your OPLL claim? You might have ossification of the posterior longitudinal ligament, OPLL, much like Natalie Merchant had. And you might be filing an ERISA disability claim. But before you do that, I want you to get out that disability policy, read it cover to cover, but I also want you to get out your medical records, because I want to talk about what the disability carrier is going to expect to see in your records. Now, I know that the diagnosis can be devastating, and its progression can, as I've said, lead to a disability claim. It almost ended Natalie Merchant's musical career. Now, the disability plans or policies will generally require that a policyholder or plan beneficiary get reasonable and appropriate medical care as a condition to getting and continuing to get paid their disability benefits. That includes getting appropriate diagnostic studies to confirm the diagnosis of OPLL. So there are three types of testing that a disability carrier is going to expect to see in your medical records. First, x-rays. They're going to expect to see that the x-rays show bony abnormalities in your spine. You might have undergone what's called a dynamic x-ray that will help show excessive or abnormal movement or instability of the spine, be it in your neck or be it in your low back. Secondly, they're going to expect CT scans or an MRI. A CT scan is a form of imaging that uses a combination of x-rays and computer technology that allows visualization of the bones, muscles, and organs. And either a CT scan or an MRI is going to allow your physician to determine the thickness of the posterior longitudinal ligament and any encroachment or pressure it's putting on the spinal cord, because remember, it's characterized by tingling and numbness. Now, if you have those complaints of tingling and numbness in the hands or in your lower extremities, the ERISA disability carrier is going to expect that you will have undergone a diagnostic study called an EMG and nerve conduction study test. That is required because they want to confirm nerve impingement. So what are they going to do once they see those diagnostic studies? Well, they're going to review your medical records to look at the nature and extent of your symptoms and whether or not they believe that your functionality, the level of your functionality impacts your ability to do your own or any occupation. Now, your physician is going to be asked to complete forms called attending physician statement forms that will comment on your restrictions and limitations. Don't be surprised if the carrier's doctors disagree about the extent and nature of your restrictions. But at the end of the day, having well-developed medical records and supportive diagnostic studies can help overcome a disagreement between your physician and that of the disability carrier about what your functional restrictions and limitations are. You'll recall that Natalie Merchant had to stop touring, had surgery. She was unable to work as a performer for a number of months, almost a year, before she returned. Just like her, I want you to keep up the courage and don't be discouraged about getting your ERISA disability benefits. If your claim has been denied or terminated, call me today at 727-894-3188 for a complimentary consultation. I can help you regardless of where you live in the United States and regardless of who your disability carrier or plan might be. 727-894-3188.